Are you constantly tired? Do you have pain all over your body? Have doctors been unable to find a reason for your suffering? You are not alone. Millions of people experience these frustrating and debilitating symptoms. Many of them have fibromyalgia or myalgic encephalomyelitis, also known as ME/CFS. These conditions are often misunderstood and can be difficult to diagnose. These illnesses are often called invisible illnesses. This is because people who have them may look healthy, but they are struggling with serious symptoms. These symptoms can severely impact their quality of life. Many people struggle to work, socialize, or even perform basic daily tasks. This can lead to feelings of isolation and despair. In this essay, we will unravel the mysteries surrounding fibromyalgia and ME/CFS. We will explore the possible connection between these two conditions. We will also delve into the latest research on their causes and potential treatments. Understanding these complex illnesses is the first step toward proper diagnosis, effective management, and ultimately, finding a cure. Let's shed light on these often overlooked conditions and advocate for better care and support for those who live with them every day. Fibromyalgia and ME/CFS share many similarities, often leading to confusion and misdiagnosis. Fibromyalgia is characterized by widespread pain and fatigue. ME/CFS involves persistent fatigue not relieved by rest. Diagnosing both conditions is challenging due to overlapping symptoms. The COVID-19 pandemic brought a surge of long COVID cases. Long COVID symptoms include fatigue, brain fog, muscle pain, and difficulty breathing. Research shows overlap with fibromyalgia and ME/CFS. Understanding these connections could unlock new treatments. Section 4. Exploring the empty sella syndrome link. Empty sella syndrome, or ESS, is a rare condition that affects the pituitary gland, a small gland located at the base of the brain. The pituitary gland is responsible for producing and releasing several essential hormones that regulate various bodily functions. In ESS, the pituitary gland shrinks or becomes flattened, filling with cerebrospinal fluid. This can lead to a range of hormonal and neurological symptoms. Recent research has suggested a potential link between ESS, fibromyalgia, and ME/CFS. A study published on ResearchGate just 4 months ago explored the role of increased cerebrospinal fluid pressure in these conditions. The researchers proposed that increased pressure within the skull, potentially caused by ESS, could contribute to the symptoms of both fibromyalgia and ME/CFS. This is a relatively new area of research. More studies are needed to confirm the connection between ESS and these conditions. If a link is established, it could open up new avenues for diagnosis and treatment. For example, medications that reduce cerebrospinal fluid pressure might offer relief to some patients. Section 5. The Epstein-Barr virus, a potential culprit. The Epstein-Barr virus, or EBV, is a common herpes virus that causes infectious mononucleosis, also known as mono or the kissing disease. Most people contract EBV during childhood or adolescence. After the initial infection, the virus typically lies dormant in the body. However, in some individuals, EBV can reactivate and trigger a range of symptoms, including fatigue, muscle pain, and cognitive difficulties. This has led researchers to investigate the potential role of EBV reactivation in ME/CFS. A 2014 study published in Verywell Health provided evidence that EBV reactivation might contribute to ME/CFS. The researchers found that individuals with ME/CFS had impaired B and T cell memory responses to EBV compared to healthy controls. This suggests that their immune systems may struggle to control the virus, leading to chronic symptoms. While more research is needed to confirm the link between EBV and ME/CFS, these findings provide a promising avenue for future research. Developing antiviral medications or vaccines that target EBV could potentially prevent or treat ME/CFS in some individuals.